Aortic valve replacement surgery is a cardiac surgery procedure where it is designed to replace the diseased aortic valve of a patient. So valves can either narrow down or start leaking in some patients for various reasons. And the aortic valve replacement is a procedure where the diseased valve is taken out and instead a artificial valve is put in its position. So there are various conditions that can affect the aortic valve, which is one of the valves, one of the four valves in the heart. And the way the valves uh, can get affected, it can impact on their function. So they either become very narrow and pose an obstruction to blood flow from the heart, or they can start leaking back towards the heart. So they cause an additional load on the heart. And either of those conditions need treatment when people develop symptoms or when it starts to cause an effect on the heart function itself. Aortic valve replacement is one of the treatments. Modern treatment is individualized, so not every patient needs to have surgery alone, but it is a very good treatment option for many people. Probably most patients will benefit from aortic valve replacement surgery. But to say it is not the only treatment option, it needs a discussion about how suitable a patient is for surgery, and it needs an assessment about their fitness to undergo surgery, and then people can be taken up for aortic valve replacement surgery. So aortic valve replacement is one of the most common operations a heart surgeon does. It is a big operation, no doubt about that, but it is also one of the safest operations overall. There is clearly the risk of dying from the operation and the risk of not surviving the operation. But for generally patients with low other conditions, meaning if they don't have other conditions that impact on the risk of the operation, then the risk of the operation is as low as 1 in 100 chance of that. There is unfortunately a risk of stroke with the operation. So about 1 in 100 people end up with a stroke. But again, the stroke may not be necessarily major. There is also a small risk of needing a pacemaker afterward the operation. The valves are located close to the electrical conduction system of the heart, and about 1 to 3 in 100 people end up with a permanent pacemaker after a heart operation, heart valve operation. Then there are other risks like bleeding or having to need blood transfusions, risk of a small heart attack or heart failure kind of situation, the risk of changes in heart rhythm, the risk of infections, the risk of being in the hospital for longer that can be predicted. But all these things are relatively minor, relatively easily treated, and people are generally uh, do well with the operation and they recover, make a good recovery in about 6 weeks from the operation. The aortic valve replacement surgery with a heart surgeon is done in various ways, and it all depends on what other conditions a patient has, what else a patient is suitable for, and what other operation a patient needs. But if a patient needs only an aortic valve replacement, then the standard way, the conventional way to do it is through a what's called a median sternotomy. So a cut down the middle of the breastbone, in the middle or in the front of the chest to get to the heart, and then replace the valve that way. But there are other ways to do it, even surgically. Surgically, there are options to not split the breastbone all the way down, but to keep it limited to half. So it's called a hemisternotomy approach, and it's classed as a minimally invasive operation as well. But there is also various ways to get to that area, either from the mid in between the ribs on the right side of the chest or from under the armpit, and various surgeons do it differently. The thing to remember is the goals should be to achieve a safe operation and an operation that works in a good way for the patient over a lifetime. And the gold standard remains a median sternotomy. So if anything else doesn't work, even then the fallback option is always to cut down the middle of the breastbone in a full way and get to the valve that way. So apart from how we reach the aortic valve to replace it, there is also the need to rest the heart during the operation to be able to perform the operation. And that is done with the use of a bypass machine, a heart-lung bypass machine, or a cardiopulmonary bypass machine. And that is connected to a patient by tubings connected to the big blood vessels in the heart and around the heart, and that then replaces the heart, so to say. So then the heart is rested in that time, and the operation can be performed by the surgeon while the machine is supporting the circulation of the body and the organs of the body. And once the operation is done, then the machine is separated, the heart takes over, and then everything is put back together, closed, the chest is closed, and then patients make recovery on the ICU and afterwards on the ward. So aortic valve replacement surgery is generally the quickest operation, one of the quick operations that heart surgeons do. It depends on how the aortic valve is at the time when we get to the valve. If it's very diseased and it's very complex, then it can be longer. But generally speaking, an operation should take somewhere about 2.5 to 3 hours in total.